Early on Sunday, I declared a public health emergency of international concern over an epidemic of Ebola disease in the Democratic Republic of the Congo and Uganda. This is the first time a Director General has declared a FIC before convening an emergency committee. I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations after consulting the Ministers of Health of both countries and because I'm deeply concerned about the scale and the speed of the epidemic. We will convene the emergency committee today to advise us on temporary recommendations. So far, 30 cases have been confirmed in the DRC from the northern province of Ituri. Uganda has also informed WHO of 2 confirmed cases in the capital of Kampala, including 1 death among 2 individuals who traveled from DRC. And there is 1 US citizen confirmed positive and transferred to Germany, as reported by the US. And we're working with the DRC, Uganda, and also the United States. First, beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Second, cases have been reported in urban areas, including Kampala and the city of Goma in the DRC. Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area. The province of Ituri is highly insecure, as you may know. Conflict has intensified since late 2025, and the fighting has escalated significantly over the past 2 months, resulting in civilian deaths. Over 100,000 people have been newly displaced. And in Ebola outbreaks, you know what displacement means. The area is also a mining zone with high levels of population movement that increase the risk of further spread. And fifth, this epidemic is caused by Bundibujo virus, a species of Ebola virus for which there are no vaccines or therapeutics. In the absence of a vaccine, there are many other measures countries, of course, can take to stop the spread of this virus and save lives, even without medical countermeasures, including risk communication and community engagement.
While many people around the world may see these outbreaks as distant crises happening overseas, international health officials say the events unfolding now are exposing dangerous vulnerabilities in the modern global system. Experts say the Ebola outbreak in the Democratic Republic of the Congo has revealed how war, instability, and mass displacement can create the perfect conditions for deadly diseases to spread rapidly and uncontrollably. Ongoing violence in eastern Congo has forced thousands of civilians from their homes, weakened healthcare infrastructure, and complicated efforts by medical teams trying to trace infections and contain the virus. Health authorities warn that in conflict zones, hospitals become overwhelmed, surveillance systems break down, and infected individuals can move across borders undetected. At the same time, the hantavirus incident aboard the MV Hondius has demonstrated how quickly diseases can travel internationally in the age of modern transportation. Within days, passengers and crew linked to the outbreak had moved across multiple countries, triggering a coordinated response involving governments, laboratories, airports, and international health agencies. Global experts say the outbreak is a reminder that in today's interconnected world, a localized infection can rapidly become an international concern. Together, both crises are highlighting three major realities now confronting global health systems. First, public health is deeply connected to political stability. Experts warn that conflict, displacement, and insecurity severely weaken disease response capabilities and increase the risk of uncontrolled transmission. Second, global travel has fundamentally changed the speed of outbreaks. With millions of people crossing borders every day, viruses can spread internationally before symptoms are even detected. And third, international cooperation is no longer optional. Health officials say no country can effectively manage large-scale outbreaks alone. The response to both Ebola and hantavirus has already required coordination between the World Health Organization, national governments, emergency medical teams, and research laboratories across several continents. Tonight, experts say the message is becoming increasingly clear. Future outbreaks may not remain regional crises for long, and the strength of the global response could determine whether the next emergency is contained or spirals into something far more dangerous.